Well, good afternoon. My clock says it's straight up noon. We'd like to welcome you to the Iowa State University Dairy Webinar Series. Today's program is the benefits of lung ultrasound in dairy calves. Uh, Today's presenter is Dr. Teresa Olivet, an associate professor in the Food Animal Production Medicine section at the School of Veterinary Medicine at UW-Madison. Her research is in promoting professional dairy industry's awareness and understanding of lung ultrasounds as a means of diagnosing and monitoring young calf health and measuring the varied impacts of interventions on dairy farm. We welcome you to the program, Dr. Olivet, and as I always say, the podium is yours.
Oh, thank you, Fred. I really appreciate the opportunity to be here today and talk about something that I've been very interested in and passionate about for more than a decade now, and that is really figuring out how do we do a better job with these young dairy calves, and especially when it comes to focusing on identifying disease in the earliest stages and then figuring out really what contributes to the development of that disease. And a big part of that over the last 10 or 12 years has been the use of lung ultrasound to identify pneumonia in calves that otherwise look normal or look healthy. And I'm going to tie into that a little bit today, GI disease as well, because when you start actually spending a lot of time with calves and seeing pneumonia when it actually starts, so before the calf looks visibly sick, you start to realize the pattern that when they have GI upset, like you see in this calf on the left-hand side of the screen, that more often than not, that calf is going to end up or already have pneumonia. Either during that bout of diarrhea or within a few days to a week after. So when I talk about lung ultrasound and respiratory disease, quite a while ago, I really started to kind of frame it in a different perspective, and that instead of just talking about those conditions as individual diseases, my perspective has changed over the years, and that I really see those clinical abnormalities or those diseases as a symptom that we've done something wrong, right? We have managed that calf in a way that does not keep her healthy. And so something that we, the people that are taking care of these calves, haven't done quite right, that allows them to get sick. And that's what I call management failure. And so I'm going to talk a little bit about that and how I use those two conditions as an indicator that something went wrong, right? So we'll go into that. I'm going to show you quite a few slides on 3 different dairies where they do a good job of recording calf disease and show you the variability in disease risks. So to give you guys an idea of how changeable it is from week to week, how much disease we can see when we're using a tool like lung ultrasound that is very sensitive and can show us with much greater accuracy who actually is affected compared to just looking at clinical signs. And then talk a little bit about screening for disease and how I evaluate some of these herbs. So I was pretty proud of myself for being able to make a meme. I know probably 10 or 12 years ago, and none of us even knew what a meme or a GIF was, but I kind of like this picture on the right-hand side of the screen because some of you or many of you might be familiar with these old Dos Equis commercials. But, I always say I don't always use an ultrasound, but if you've gotten to know me at all, if you've seen me speak before, that well, I probably always use an ultrasound. So there is going to be a heavy focus on that in this lecture. If lung ultrasound is something that is a completely new concept to you, then hopefully this is a springboard to get you thinking about it. If you've, talked with your veterinarian, if you are a veterinarian or a consultant that's been involved using lung ultrasound, then hopefully this talk will give you some things to think about how you're implementing it on your farms. And if anything, it'll just hopefully create, get your neurons connecting to think about, how you're recognizing disease on the farm to kind of do a better job. All right. So kind of a first big picture thing is thinking about in general when we're raising these young calves, all the things that we do that are different, that they are not how mom designed. And I bring this up not as a blanket statement to say all of these things are bad or all how we raise dairy calves these days are bad. But I think it's really important to recognize that from the perspective of the calf, we create a lot of man-made stress on these animals, right? We separate the calf from birth, from the dam at birth. We tube feed them colostrum in a lot of operations. We feed them twice a day in many operations. Some are feeding 3 times a day. I was just in Ireland where some folks are feeding once a day. We do bottles or buckets. We feed powder versus whole milk. We house them inside. We keep them in individual housing situations where they don't have any social interactions, but then sometimes we actually put them in pens that are excessively large and they have too many social interactions. We don't keep them warm enough or we keep them too warm. There's a lot of things that create stress in the life of the calf. And all of these stresses really serve to open up windows or opportunities for that calf to get sick, right? And again, I'm not condemning necessarily any of these practices, but I think we have to recognize that raising calves is hard. We have an uphill battle, and we have to be on top of things every single day, every single feeding, in order to do our best to minimize upticks in disease. And I've got this video that hopefully is playing for you. And yes, you should recognize that this is not a dairy calf. This is a little crossbred calf. But my point here is that this calf had 5 liters of milk to drink. And if the timer is going on this video, which I don't think you can see, but it's about 32 seconds for this calf to finish that bucket, that 5 liters, a little over a gallon of milk. And again, the point being that when we're feeding these calves, this is not a normal situation, right? If calves were latching on to mom, it would take many, many, many minutes for that calf to finish their meal, right? So we feed them in a way that allows them to drink really, really fast, which can have some negative implications, negative side effects associated with that. And I think it's just important to be aware that even if we do things to the best of our ability, it's still not always the best thing for the calf. And because with that kind of background, and a lot of the things that go wrong in the early life of that calf, what I'm seeing now with years of using lung ultrasound to look at the lungs is that the lungs to me are really the window to calf management. So many of you might be familiar with this phrase at the top of the screen: eyes are the window to the soul, old Shakespeare quote. But to me now, the lungs are really the window to calf management. So when I see something wrong in the lungs, to me, it's an indicator organ that tells me we've done something. If that calf has respiratory disease, and I'm seeing it in the lungs, that is a symptom of management failure. And management can affect, several different things. And so if we are not able to get colostrum in our calves in a timely fashion, if for whatever reason calves are having too much failure passive transfer, we're going to see it manifest as more pneumonia than otherwise we would see that. If those calves get diarrhea, we see more pneumonia. We see it in the lungs. If they're septic, we see it in the lungs. If they don't have good nutrition, a dirty environment, cold stress, heat stress, we can see that crop up as pneumonia in the lungs, right? So again, when I see abnormal lungs, it's a flag to me that I got to go back in time. I've got to look at the life. I've got to look and see what that calf has experienced since even probably when she was still in utero, the end of the dry period for her dam, to the point where she was born and the first few weeks of life, and see what could have happened in that short window of time that didn't go quite right, that increased the risk of pneumonia in this calf. And this happens at the herd level, so in these calves. And something that we'll talk about is my #WeanClean philosophy. And this is that idea that if we can get calves to and through the weaning period with nice, clean lungs, then we are setting them up for their most successful future. If they get to weaning and they have abnormal lungs, that means we either didn't detect the fact that they had pneumonia and didn't treat it, therefore they still have pneumonia at weaning, or we did detect it and we did treat it and it didn't respond to treatment, so they still have pneumonia at weaning. And so with this idea of WeanClean in the background, it kind of brings things together to think about what can we do for these young baby calves to make sure that they have the best success to get through that weaning period with the least stress possible, so they can perform as best as possible. Right. When we think about risk factors for disease or areas where management failure can occur, there's a whole bunch of them, right? This is kind of a busy slide, but it's really how my brain works when I'm thinking about what can go wrong that's going to increase the risk of either GI disease or respiratory disease in these calves. A lot of times the risk factors for diarrhea and the risk factors for pneumonia are the same thing. And so I rarely separate out the two. If I get called out to a farm to work up or troubleshoot a respiratory disease problem, I very often am looking for risk factors that contribute to GI disease or contribute to diarrhea because they can also contribute to respiratory disease. But again, just the fact that a calf gets diarrhea increases her likelihood of getting pneumonia. Okay, so I spend a lot of time, even if I get called out for a pneumonia issue, dealing with a GI, with a diarrhea issue. And so the way I break up these risk areas, and this, should be very familiar with many of you, is breaking up into passive transfer area, nutrition, sanitation, concurrent disease, facilities and environment, social factors, and biosecurity. And I've kind of ordered them a bit in sort of in my mind of priority. And then within each of these silos are kind of the different factors, the different things that can go wrong that contributes to problems within that area, right? So when it comes to passive transfer, that's really going to be dependent on the amount of colostrum they get, the number of meals they get, the timing of the collection of the colostrum from the dam, the timing of when we feed it, the bacterial load, IgG concentration, calf dam separation, dam diet, right? I'm not going to go through all of these individual things in each silo, but it gives you an idea that within each of these areas, there are a lot of things that can go wrong. And we need to have good training, good protocol development, and good monitoring to make sure that all of these things are getting done the way we want them to get done in a very consistent manner. And then another thing I'll be talking about is how we're identifying disease. When we have a good means of identifying disease, a good means of knowing what all of these factors are for our farm, then we can start making relationships, start seeing associations for when one thing goes wrong and when we see the uptick in disease. And how it works is all of these factors, right? When they go wrong, they're going to either serve to reduce calf's immunity, making her more susceptible to disease, or they're going to serve to increase the pathogen exposure, which is going to increase the disease. Or they might do both, right? Dampen the calf's immunity and increase pathogen exposure. Double whammy, we see much more disease. Okay. All right. So it's really important to think about what your calves can tell you or what your clients' calves can tell you. If you just ask the right questions and if you just spend the time looking, we can, on paper, do everything by the book, right? We can follow the best standards, the best management practices, but it really comes down to making sure that we look at the calves and see if they are telling us if our program is working or not. And what they can tell you is a lot of different things, right? If you look at those calves, they can tell you when the challenge is manifesting, right? So when is disease actually starting, right? Which is telling you, when they're experiencing the problems. They can tell you the severity of the challenge. They can tell you whether or not there's another condition that's masquerading as bacterial pneumonia. So there are several things that look like pneumonia from the outside, right? A calf that is depressed, heavy breathing, and has a fever. Maybe she has a cough, maybe she has a little snotty nose, right? Our knee-jerk reaction is to say she has respiratory disease, but there are other conditions that could actually be causing that. Septicemia being one of the most common reasons, one of the most common conditions that masquerade as pneumonia. On an individual level, on a single calf here and there, we might see congenital heart disease that's masquerading as bacterial pneumonia. Again, at the group level or the herd level, we might see acidosis, right? Again, a depressed calf, breathing heavy, maybe not have a fever. So the calves, if you look and ask the right questions, the calves can tell you exactly what's going on. They can tell you where and when an intervention needs to happen. They can tell you that if an intervention is working. They can tell you if cold and heat stress is a problem. Is there an issue in maternity? Is colostrum management an issue, right? The calves, if you ask them and if you listen to them, they can tell you and answer these questions for you. And so I'm going to first start out by just looking at and asking the question about the pattern of pneumonia in your farm. And this is going to be some slides that have utilized data out of DairyComp. So many of you on this call might be familiar with DairyComp, our software system here that we use in the States and in several other countries for managing cows on farm. fortunately, more and more producers are using this to keep track of calf health records, health events, which is really helpful, instead of just using a notebook in the barn. If you can get your records into your software program, it makes understanding what's going on much easier. And so I'm going to show you 3 different farms. So this is farm 1, and what it's showing you is just the count of events. So that's the number of pneumonia events that have happened on this farm over the course of a year. And each bar represents a week, right? So it's a number of events by week. And so you can see, and this is first pneumonia event. So this would have been, they got treated for the first time for pneumonia. And you can see for this particular farm that it goes from 3 to 10 up to 16, 17 cases per week, depending on the time of the year. All right. And it's quite up and down, right? You got some weeks with none, you got some weeks with a whole bunch, kind of up and down. This is the second farm, and your eyes should be kind of taken aback at the fact that, whoa, there's a whole lot more red, right, on this farm. And to give you some perspective, the 3 farms that I'm showing you are all about the same size, okay? And so again, here we're seeing anywhere from, 6 or 7 at its minimum cases per week up to 24 to maybe 30 cases a week being treated. Again, a lot of variability in the number of calves that are being treated every week. And then here's farm 3. Again, seeing quite a bit of variability over time, but you would all probably agree that we're seeing a lot more cases being treated in farm 2 and 3 than we would in farm 1. So to dig a little bit deeper into that, I want to look at how old are the calves when they get treated for pneumonia for their first time. And again, this is graphs being pulled out of Dairy Comp. And what this is showing us is the age when that calf is treated for the first time for pneumonia over the course of the last year. And each of these little red squares represent an individual calf. All right, so what you can see in this farm is that, there's some calves that are getting treated around a month of age down here, some even a couple even a little bit younger than that. But it looks like on this farm, the bulk of the calves are being treated around 96 to 120 days. Okay, you see that right here. So visually, that's what we're seeing. Okay, so around 4 months, 3 to 4 months is when calves are being treated for the first time, with a few down here in the early stages. Okay, this is again farm 1. Remember farm 1, when I showed you the bar graphs, farm 1 was treating, a couple calves a day, not very much compared to farm 2 and 3. Here's farm 2. Okay, so this is a very different looking figure than what we saw in that last one. All right, so again, looking at age when they're treated for the first time over here on the y-axis. Now we see really distinct clustering right between, say, 14 to 30 days of age. And you see many calves being treated kind of clustered all together. Kind of a very symmetric pattern here. Here's farm 3, and again, a very tight pattern early on, between 14 and 30 days of age. You see a few more first-time treatments out here around 96 days, but hopefully you're getting this sense that between farm 1 and farm 2 and 3, things look very different between the number of animals that are being treated for pneumonia and the age of onset when these calves are being treated for the first time. So all I've done for farm 2 is I've just blown up the figure to look closer at the age group. And so we can just see more clearly that for farm 2, around 10 or 12 days is when we're seeing that earliest calf, and then up to about 30 days. All right, kind of similar for farm 3 as well. So got to be thinking, well, what is the difference between farm 1, 2, and 3, right? Is there a difference in the disease challenge, right? Is there a lot more disease challenge on farm 2 and 3 that calves are succumbing to more pneumonia? They have more of those risk factors that I showed you in that first few slides. Is there a difference in how disease is being detected? Right, so is farm 2 and 3 spending way more time looking at their calves? Are they defining disease different? So Are they using a more liberal definition of disease? So therefore, they're catching more positives potentially, right? So those are all the things that you really need to be thinking about when you see numerically and visibly different levels of disease on multiple farms, okay? One would like to think that farm one, because you saw fewer calves treated later on, that things might be going better on that farm, okay? Versus a high number of calves being treated early on in life for farm 2 and 3. Since I know these farms, I know the answer to this question, right? And it's a little bit of a loaded question. But in this situation, it's a disease detection, disease definition issue, right? So in farm 2 and 3, they actually do a weekly exam of all high risk calves on that farm. And they're using ultrasound to do this, which means that they can find calves that have pneumonia that don't look visibly sick. And their rationale for doing this is because they want to treat calves that have subclinical pneumonia. If you get them treated before they show visible signs of disease, they respond better and they do better. All right, so farms 2 and 3 are doing that, and farm 1 is just going based off visible signs of disease. So when you're using a much more sensitive tool like lung ultrasound, you're now going to be able to find way more calves that have disease than you would if you're just using clinical signs. And you're going to find that the disease starts earlier in those calves because calves tend to be have pneumonia and be subclinical, so not show any clinical signs. It can be several weeks. So we can find disease far earlier. And that's what we're seeing when we compare the overall numbers of calves affected and the age at which calves are treated for the first time. Okay. And so that's the value of lung ultrasound, is that we can find those hidden cases of disease. And I'm going to show you some video here, hopefully that you can see them playing on your screen. The top calf, this is a 5-week-old Holstein bull calf. Then we have a 10-week-old Holstein heifer calf here in the middle. And then the bottom calf is a 3-week-old Holstein calf, bull calf. And what I want you to think about is who has the worst case of pneumonia, okay? The top calf, this calf does not want to walk. There's droopy ears, if we could zoom in at the head, snotty nose, got that classic head and neck outstretched position, trying to breathe. It's thin if you could run your hands down his top line. This calf, I think anybody would agree, this looks like a chronic clinical pneumonia calf. No brainer, right? Well, then we have this calf here in the middle, this 10-week-old calf. And I'm going to grab her trachea here and shake it. She's going to cough a couple times. So she's got a cough. She's got droopy ears on both sides. Okay, so today when I'm there examining her, she has visible signs of disease, clinical respiratory disease. But the most important factor about this calf is at 10 weeks old, she should be about as big as this heifer poking her head through the door here. All right, she should be about 210 pounds. She weighs 105. So we had a digital, we have an actual weight on this calf. 10 weeks old, she weighs 105 pounds. So if you're familiar with that recommendation that we double birth weight by 60 days of age, typical Holstein calf, if they're born at 90 pounds, by 60 days of age or 8 weeks, they should weigh 180 pounds, right? So 10 weeks old, she ought to weigh around 210. And here she is at 105 pounds. So she is severely stunted. She has clinical signs of respiratory disease. And you might think, well, she's probably got chronic pneumonia, and that's why she's so small. Okay. This third calf here, this 21-day-old calf, you can see he's bouncing around his pen. He's sucking on my finger. He's very happy to see me. He's got no nasal discharge, no cough, no fever, no snotty nose, no runny eyes, right? This calf seems very happy compared to these other two calves. And then what I ask you to think to yourself, okay, who has the worst lungs? And so what I'm showing you here is the necropsy pictures from when so all three of these calves would have been euthanized the same day these videos were taken. And we're looking at their right lung. So each of these images is of the right lung of each calf. You could imagine the orientation is that the lungs are still in the chest. The calf's head is over to the right side of the screen. The calf's tail is over to the left side of the screen. And I've lifted up the rib cage so that we're looking into that right lung. And we can see the heart kind of poking through right here in each of these images. Okay. Now, you might be very familiar with what normal and abnormal lungs look like, but if you're not, these pale pink areas, these are, if you were to touch them, they'd be very light, fluffy, full of air, normal areas of lung that you can see. And then we have these abnormal areas of lung that are dark red, purplish color. If you were to feel them, they'd be very firm, solid tissue-like. And these are areas of bacterial pneumonia, okay? And there's one lung lobe affected here in that top calf and a second lung lobe affected here. Each of these lung lobes is about 5% of the mass of the lung. So the first calf has about 10% of the lung involved. If you look down here at the second calf, there's just a few little focal areas of pneumonia. So maybe 1 or 2% of the lung is affected. And then when we get down here to calf 3, that calf that's happy as a clam bouncing around, we see one lobe completely affected and the second lobe completely affected. So again, about 10%. So I show these 3 calves to highlight to you that subclinical pneumonia exists. This third calf is a prime example of subclinical pneumonia, never been treated before, never missed a meal, never shown a sick day, and has 10% of the lung abnormal with pneumonia. Compared to the top calf, also has 10% of the lung affected, but is very obviously visibly sick with pneumonia. And then this calf in the middle that looks like she has pneumonia, but she's got hardly any lesion in her lung. Okay, so moral of the story is that clinical signs and degree of disease in the lungs don't always match up. So we cannot predict based on what that calf looks like, A, whether her lungs are normal or abnormal, and B, if they are abnormal, how abnormal are they? Okay. When we start looking at these calves, and if you're scanning lungs on a routine basis, what we've learned over the last several years is that it depends on the farm, but at least 50% of new cases of pneumonia are subclinical when they start, meaning they don't tell you that they have pneumonia when these lesions first start. And that number, I put 50% here, that number for most farms is actually probably closer to 80 or 90% of new cases are subclinical. And so that means there's a lot of calves with pneumonia that's starting well before we can ever see them. And if we think about our treatment efficacy, and if we want treatments to respond to cause, resolution of disease, we need to treat them as early as possible. But if we're a farm that's dealing with a lot of subclinical pneumonia, it's quite possible that our calf's going to have pneumonia for 2 or 3 weeks before they ever get treated because they're not telling you that they're sick. Okay. And then if we just look kind of overall, like a cross section of your calves, right? So not necessarily new cases, but existing cases of pneumonia on your farm. For every sick calf that you see, there's going to be 2 to 4 subclinical calves out there. All right, so if you're used to treating about 10% of your calves for visible signs of pneumonia, you can expect that there's an additional 20 to 40% of your calves that also have pneumonia, all right, that you don't know about. Okay, so I hope this slide kind of highlights the fact that, like many diseases and issues that we deal with on farms, there's this iceberg effect. So the disease that you see, which in this case is going to be the clinical pneumonia, is just the bit of the iceberg that you see over top of the water. And the bit of disease that you don't see, the subclinical pneumonia, that's that big, huge part of the iceberg underneath the water. So until we're using a tool like lung ultrasound, we can't figure out how much of our calves are dealing with that subclinical pneumonia. Okay. Also means that when we can't see that population of animals with subclinical pneumonia, we're not necessarily tuned into when things are going wrong management-wise, because we can't see that anything is wrong with the calf yet. But if we can tune in to the subclinical aspect of disease, we're going to be tuned in better to when management failures happen, okay, when protocol drift occurs, because now we've got our pulse on this subclinical pneumonia that's going to raise a red flag. When it goes up, we know we have to go look and figure out what's going on. All right. So I kind of highlighted here what subclinical pneumonia is, how common it is. The other thing I want to highlight, and hopefully you picked up this a little bit from those figures that showed the age at first pneumonia over time, is that the risk period for pneumonia is not the first year of life. There's a lot of parameters, there's a lot of benchmarks out there that look at, the percent of calves that have pneumonia before 365 days of age. And what I want to emphasize here is that most calves, if they're going to get pneumonia ever in their life, it's going to happen in the first month, probably within the first 2 to 3 weeks. Okay. If you're using the right tool to identify it. Rarely does it start during that post-weaning period, but that's another very common time that pneumonia gets identified is when we move calves from their pre-weaning housing to their post-weaning housing. And then they all start coughing and you have the supposed outbreak and you feel like, gosh, there must be something wrong with my post-weaning management because they all of a sudden have pneumonia. Well, typically what we're finding is that most of these calves actually have pneumonia before they're ever weaned, but it's subclinical. Then they go through the weaning period, they get stressed. They have a new social environment, they have new facilities, they have a new diet, and it's the straw that breaks the camel's back and they break and become clinically affected. So it's important to realize if you're seeing an uptick in clinical disease in the post-weaning period, you've got to go back and look in the pre-weaning period. It's probably starting there. Because if it's starting in that pre-weaning period, it probably doesn't matter that much what you do in the post-weaning period. It's probably not going to get that much better. Okay. And the period of time when they are at risk for disease, it can be very narrow, right? Usually it's a couple weeks of time where if they're going to get pneumonia, it's probably going to happen between, let's say, 10 and 24 days of age or 14 and 28 days of age. It's a very narrow window. So that period of risk that period of high risk can be quite narrow. And that's important because when we want to manage our calves around disease or manage the disease, knowing exactly when it starts and know exactly who's at risk is really helpful because that's where we have to focus our attention. All right. And we just cannot do this well without using the lung ultrasound to figure this out. Okay. All right. So I don't have time in this webinar to go into a lot of the research that's happened, but I will show this figure that's just showing that when I got involved in lung ultrasound on the on-farm basis. So I do want to specify that lung ultrasound is not a new thing, right? Ultrasound has been used for decades to identify pneumonia in people, horses, and even calves, small animals. It's not a new thing. What's new is doing it at the herd level out on farm with portable equipment. Okay, so up until I started doing this about 2010, if you looked in the literature, there are only 7 papers that use lung ultrasound as a diagnostic tool for calves. Okay. Most of these studies were out of Europe based on hospitalized populations with animals of a variety of ages from a few weeks to 6 to 8 months of age, that tended to be severe chronic cases of disease because they were hospitalized animals, right? So only 7 papers. And then in the last 10, 12 years, there's really been a big uptick in the literature that's available, a lot of the research. And so we know a lot more about this tool than we ever have. All right, and what have we learned? We've learned over time, and this is not just my research, but this is research out of Canada, out of Europe as well. But this lung ultrasound is something that it is very fast. This is something here I say it takes less than a minute. So it's nearly instantaneous. When you put an ultrasound probe, if you put it in the right place, you know immediately, does this calf have pneumonia or not? Okay, so it's rapid, it's highly sensitive. So what that means with a sensitivity greater than 88%, that means that if we had 100 calves with pneumonia, even if she didn't show any visible signs of disease, that we would detect at least 88 of them. So 80 out of 100 calves. Whereas if we were just using our clinical exam, we would only find 60 to 70 of those calves. Or if you're using our stethoscope and doing auscultation, so listening to the lungs, we would only find 6 to 10 out of 100 of those calves that are affected. So the ultrasound is a much more sensitive tool. It's going to allow us to much more accurately identify who has disease. And when we do that, we could then measure short-term and long-term outcomes. So we can see that calves with these ultrasonographic lesions in their lungs don't grow as well as their normal counterparts. And so you can see this picture on the right-hand side. This is a pretty classic example of a calf who's had chronic clinical pneumonia versus her herd mate that's not. So the calf on the left just had pneumonia here for about 3 weeks and her healthy herd mate. And you can see substantially reduced stature in this calf. When we use the ultrasound to identify these lung lesions and identify pneumonia in these calves, we actually can see and have figured out that just 1 centimeter of lesion on the ultrasound, that's very little. Calves with pneumonia can have up to 90 centimeters of lesion on their ultrasound. But if they have just even 1 centimeter disease, they're going to grow slower than their unaffected herd mates. Okay. We can see responses to vaccine. We can see responses to antibiotic treatment using the ultrasound. So we can see lesions come and go based on the interventions that we're applying to these calves. You can also see that in the long term, calves that have these ultrasonographic lesions are more likely to die before their lactation, be removed before their first lactation. They're going to be slower to get pregnant. And then the big take home here is that they're going to make less milk in their first lactation. And so in the study that we did that looked at that milk production, we looked at calves and said if they have 3 centimeters or more of lung lesions on the ultrasound in the first 2 months of life, how is that tied to their future milk production? And it's 1,200 pounds of first lactation milk, or 525 kilos. All right, that's interestingly very similar to the amount of milk that's lost from poor average daily gain. So you might be familiar with some of the work out of Cornell with Silveron and Van Amberg, where it's the common saying is that for every pound of average daily gain, it's 1,500 pounds of milk in the tank for lactation. 1,200 pounds, pretty close to 1,500 pounds. And so it's highly likely that the reason those numbers are so close is because the calves in that Cornell study that weren't growing, that had the lower average daily gain, probably weren't growing because they had pneumonia. Okay. We have found that lung consolidation is a heritable condition. All right. So this is really important. And I think as a industry, we've got to really start thinking about what this means long term for us. But we found when we looked at calves, we looked at them, we scanned these calves at 3 weeks of age and at 6 weeks of age and found that the heritability of these lung lesions at 3 weeks of age was 0.21. That is really pretty darn high heritability estimate. It lowers dramatically that the lung lesions that develop at 6 weeks of age, the heritability was 0.01. All right, so what this is suggesting is that calves that develop lung lesions very early in life, the first few weeks, are much more likely to be due to a genetic component, whereas calves that develop it later on in the pre-weaning period have a more of an environmental impact. I think that makes a bit of sense on the environmental side. More time they spend in the environment, more likely it's going to cause some negative implications. But I think if there's anybody here in the webinar that's listening to this that's got involvement in the genetic side of our industry, you've got to be really thinking about what this means, because there's a little part of me that says, boy, I think until we get on top of the genetic side of things, we may not really be able to get a handle on respiratory disease in these young calves. And then the last couple of things here that we've shown through research is that the resolution of disease after we treat them with an antibiotic is not guaranteed. I'll show you some pictures about that. What that means is just because a snotty nose and a cough goes away doesn't necessarily mean that the lungs have actually gotten any better, okay? And then when it comes to attitude scores and feeding behavior, if a calf has subclinical pneumonia, they look normal. They act normal. And we've shown this, that attitude scores don't change. If a calf has subclinical pneumonia, we're not going to pick it up in an attitude score. We're not going to pick it up in a change in their feeding behavior. If they have clinical disease, yes, right? Clinical calves, they look sick. They tell us visibly that they're not feeling good. And then they change their feeding behavior. They drink slower. They have more unrewarded visits because of the change in their behavior associated with being clinically and visibly sick. But we just don't see those things when it comes to subclinical pneumonia. So relying on autofeeders to detect pneumonia early is problematic because subclinical disease is not affected with does not affect drinking speed and number of visits. So we can't expect the feeders to detect disease as early as is ideal because it's going to miss out on all those calves with subclinical pneumonia. Okay. All right, so we've learned a lot over the years with these research studies. We've come up with a scoring system. So you're going to hear me refer to a 0 to 5 scoring system, with a 0 being a nice, pristine lung. A score 2 is going to be a calf that has some lobular pneumonia. That just means a small patchy pneumonia with at least 1 centimeter of lesion. And there can be quite a variety of score 2 lungs. You can see 2 versions here one calf in the upper middle that's got just a few small spots, where this calf in the upper right has some more extensive lobular lesions. A score 3 means the calf has one lobe that's completely consolidated. We call this a lobar pneumonia. A score 4 means there's 2 lobes affected with a lobar pneumonia, and a score 5 means there's 3 lobes or more with lobar pneumonia. And you'll notice there's not a score 1 here. And I left that off because score 1 lungs, I don't see very much in pre-weaning dairy calves. These are going to be heavy, wet, rubbery looking lungs that don't actually have consolidation. They don't have these little red solid areas on them, but instead they have more what we call interstitial disease. That means that they've got some inflammation around the airways, but not in the airways. And when we see that, we think of sometimes viral infection can do that, although depending on your region, your geographical location, but here in the continental US, we don't see very much viral respiratory disease in young dairy calves. And then septicemia is going to be, so a blood infection we will often see associated with interstitial pneumonia. And the most common pathogen in that situation is going to be Salmonella. So if we see a lot of ultrasound score 1 lungs, these heavy, wet looking lungs, then I'm very suspicious that septicemia is present. And Salmonella is going to be a very common cause of that. If they're very, very young calves, 1, 2, and 3 days old, we'd have to be thinking about an E. coli septicemia. But again, in pre-wean dairy calves here in continental US, we don't see a ton of those. But if you happen to be on a farm that's struggling with Salmonella, you might see a whole bunch of ones. It's got to be a big red flag to you, okay, that maybe there's something going on. So what does this process look like? Okay, so here I'm showing you a video. Again, this is a tool that's meant to be done on a large number of calves, right? I want to be checking a large number of calves frequently. And so it has to be a rapid technique. And so for probably the past 5, 6 years, I've been teaching all my students, basically just before COVID, since COVID, when I had all my students taken away from me and I had to learn how to do this by myself. I teach everybody now to scan and restrain and collect the data without the help of anybody, okay? Which is very possible in this individual housing. You put the calf in the back corner, put her head between your legs, and then you put a little alcohol on each side of her chest, and then you put the probe on, and within a minute, you're gonna have your answer. Does she have pneumonia or not? And you could put a score to it. Is it a 0, 1, 2, 3, 4, or 5? And what we're looking at on the ultrasound, and I'll show you the video on the right-hand side. Hopefully that's playing for you. This is a normal lung. In normal lungs, let me just get it right. I'm gonna, try to do that. What you're gonna see on this normal ultrasound is just a series of horizontal white lines coming in. So over here, this is normal lung. There's a heart, here's normal lung, there's normal lung. Okay, so a bunch of white lines going across the screen, horizontal white lines. And every time you see a black blip come across, I'm crossing over a rib. So this is an actual exam from front to the lung to the back of the lung. And I'm going to walk you through it here. So here I'm the 6th rib space. There's the 6th rib space. 5th rib space, the 4th rib space, the 3rd rib space, the 2nd rib space, and the 1st rib space. And boom, just in that time, I fully examined the right lung in that calf, and it's normal. When we have abnormal manure, oh my gosh, guys, abnormal lungs, we're not going to see these horizontal white lines. We're going to see more gray speckling, solid chunks of lung here. So this image is showing, the right lung. Here we're in the right middle lung lobe. There's pneumonia right here. We're in the caudal cranial lobe. There's pneumonia right here, this triangle area. We're in the cranial lobe in front of the heart. This is all pneumonia. So again, I've just scanned everything I need to scan on that right lung. And I've seen 1 lung lobe that's completely affected here, a 2nd lung lobe that's completely affected, and then a 3rd lung lobe that's completely affected. So this calf is a score 5. So you can see the time that it takes. So that's about a 15-second clip. I can tell you that this calf is a score 5 lung. Okay, so that's how fast it takes. Here is that image, the abnormal ultrasound image that I just showed you, and what this calf's lungs look like are right here. So she's got 1 lung lobe completely affected here, a second lung lobe completely consolidated here, and a third lung lobe completely consolidated there. So a score of 5 lungs. So it's a test that happens rapidly. We do have farmers now and veterinarians that are working and have much more intensive calf management programs over the last several years because of their ability to use lung ultrasound. And so they are doing routine, regular scans on all the calves that are at the appropriate age range for their farm that are at high risk of developing pneumonia. They get scanned every week, and their lung scores are getting entered into their computer software. And so if you're using DairyComp, this means entering a user-defined event. And a lot of farms are calling it the Lung US or the Lungus event. And in their remark, they put the ultrasound score. So it's a very good way to keep track of these lung ultrasound findings when you're using it in a routine manner. And so what I want to show here, as I mentioned before, that we can see whether or not an antibiotic is working, right, by using the lung ultrasound. And this is a study that we did where we actually took a group of calves and infected them with Pasteurella, which is one of the most common bacteria to cause pneumonia in young dairy calves. And so this top figure is showing us the percent of calves that have an ultrasound score 3 or more. That means they have a lobar pneumonia. Their lungs look like one of these 3 images. So in the beginning of the study, nobody had those lung lesions. We infected them, time 0. And between 6 and 12 hours, we could see that the percentage of calves with lobar pneumonia goes up. The solid boxes are saline-treated calves. The gray boxes are ampicillin-treated calves. And you can see that the same calves in both groups got about the same amount of pneumonia, but the calves that got treated with ampicillin, so their proportion of calves with severe disease resolved over time went down. So they were treated between 2 and 5 days after challenge, and to the point where we only had 1 calf in the antibiotic group that still had pneumonia versus the saline calves, or many of them did. And so that's great. We could see that ampicillin caused resolution of those lung lesions, resolution of pneumonia. But what we weren't expecting to see is that there was a relapse over time after the antibiotic was not being given anymore. So 2 take-homes here from this is that the lesions can come and go, but then they can come back again when we give them an antibiotic. The second take-home is that when we look at the proportion of calves that were visibly sick in the study, we don't see any pattern here, right? We see much fewer calves with visible illness. And then we can't really tell, well, was one group different from another? It's all kind of over the board. All right. And so we repeated this study several times and have seen that same pattern, that if we don't treat them or if we use the standard treatment, we're going to get relapses of disease. Whereas if we actually, in this ampicillin example, if we go to twice a day, it's labeled for once a day. If you go to twice a day, we actually don't see the relapsing of disease. It's not just an ampicillin issue. This is a study where the first treatment was Draxxin. And in this study, BRD1 means the first time they were identified with disease with the ultrasound and clinical scoring. A little over half had clinical disease, a little under half had subclinical disease. And at weaning, only 15% had clinical disease, but 65% of those calves still had subclinical pneumonia despite being treated. And the big whammy here is that these calves were treated not once, but 80% of them were treated twice, and 65% of them were treated 3 times. So we still have, if you combine these 2 groups, 80% of calves with pneumonia at weaning, even though most of them have been treated at least twice, if not 3 times, okay? So when we think about if our treatment protocols are working, until we use an ultrasound, we can't figure this out. And so when we wean those calves and they flare up with clinical disease post-weaning, it's because they already had disease before we actually weaned them. Okay, so we can get kind of lulled into a full sense of security. How am I doing for time, Fred? Are you in the background there?
You're good for time. We've got about 10 minutes left for presentation, and questions can go another 20.
Okay, perfect. So what I want to show you here is that when we're using the ultrasound, there are very specific landmarks that we're looking for on the ultrasound to tell us that we have seen everything we need to see. And so on the right-hand side of the calf's chest, we're looking between the first rib space and the 10th rib space. That's where the lung lives. And pneumonia likes to happen in very specific spots. And so most commonly, pneumonia is going to happen up in the first and second rib space, which is the cranial lobe right here. And then second most commonly, it'd be kind of split between the third and the fourth space, which is the cranial caudal lobe, or the fifth space, which is the right middle lobe. And I can just put an ultrasound probe on the calf between the ribs, and I can see these landmarks, and they will tell me where I am. I know if I see this image here where I see the pleura, which is that bright white line, which represents the surface of the lung, and I see it kind of step down and around these two vessels, I know with confidence, based on our work, that I'm looking at the right cranial lobe. This is the most common place to see disease. I have to see this image in order to be confident that I've seen everything I need to see, right? If I see lung and then the heart, I know I'm looking at the caudal cranial. If I see the lung diving down and I see this kind of speckly little round structure show up, I know that I'm looking right here at the right middle. And then if I see this diaphragm and liver creep in, then I know I'm looking at the caudal lobe. So there's very specific things to look at. It's very important if you're doing lung ultrasound that you get trained properly to do this. Otherwise, boy, you could cause quite a mess if you don't really know what you're looking for. And what I want to show you is the importance of this cranial lobe on the right-hand side. We do scan the left-hand side as well. There's only a few spots you have to scan on the left-hand side just because disease tends to happen more commonly and more diffusely on the right-hand side. But the reason we need to look in this right cranial lobe in the first and second rib space is because, like I said before, this is where pneumonia happens if it's going to happen most commonly. So the data over here on the right-hand side, what I'm showing you in about 800 calves, is just the proportion of calves that have pneumonia, so an ultrasound score 2 or higher, and I'm breaking it down based on age, just the age and days. So you see this farm has no shortage of calves with lung lesions. So disease is starting between 11 and 14 days of age. And what I'm looking at is of those calves with ultrasonographic pneumonia, and you can see by 15 to 18 days, 22% of them, by 19 to 22, over 25% of them, and you can see going on and on and on. They accumulate over time. But even as early as age 11 to 14 days, 88% of those calves that had pneumonia had it in the right cranial lung lobe, 88%, okay? Of those calves, right, that had pneumonia, 59% of them only had pneumonia in that right cranial lung lobe, okay? So the reason I emphasize this is because it's a little bit hard to get up here if you're doing the ultrasounding. This takes some effort. It definitely takes training to do this, and it's very easy to miss if you don't know what you're doing. If you don't scan this lung lobe, if you don't scan right here, this is telling you that you're going to miss 60% of the calves that have pneumonia between 11 and 14 days on this farm. This is one dairy, right? You're going to miss 70%, 69% of the calves with pneumonia between 15 and 18 days on this farm. Half the calves between 19 and 22 days. Hopefully this is sinking in, right? If we don't scan this lung lobe, we are going to misdiagnose all of these calves, right? So the whole point of using an ultrasound is to get what we call fidelity of diagnosis. That is to get a highly accurate representation of who actually has disease. So if we don't do the correct technique, we are not going to achieve that, okay? We are not going to be hitting the mark here. All right. So we talked about the scoring system already, so I won't go into too much detail. Here's what a lobular lesion looks like on the left-hand side. Here's what a lobar lesion looks like on the right-hand side. We can also not just identify whether they have bacterial pneumonia or not, but we can also find abscesses. And so here we're looking at an abscess. This is a 6-week-old, Holstein bull calf. And so with abscesses, we can actually see very fluid-filled content here. And this is a bad thing. We're not, in general, in a regular commercial calf out on a farm, we're not going to fix this, okay? If you have a very highly valuable animal that you want to bring it to a hospital, there are some things that we could try to do to salvage this calf. But in general, when we see lung abscesses like this, these calves are not going to be productive members of society. Okay. And thinking about risk factors, anything, like I said before, that, and a lot of these risk factors are not, surprising: passive transfer, cleanliness, group sizing, air quality, nutrition. When we're using the lung ultrasound, we can actually see the proportion of calves with disease go up and down. And so what this figure is a lot of information showing you on this, but basically it's looking at birth week on the y-axis. Oops, somebody's not muted, I think. All right. So we're looking at the proportion of calves that have pneumonia.
It's all right. That's fine. Just, yeah. You want just one tablet or you want those tablets?
Somebody is not muted, I think. If you could mute yourselves. Thank you. So this gray bar, that's just showing the number of freshenings over time. The blue bar is going to be calves that had serum total proteins of greater than 5.7. The orange bars is proportion of calves with serum total proteins greater than 6.1. And we can see that passive transfer is highly variable. And this ties to a variability of abnormal lung lesions as well. So when we're using ultrasound on a weekly basis, which is what a lot of farms are doing now, we see an uptick in disease. We can go back and look at those records from the last couple of weeks and see, did we have an uptick in failure passive transfer as well? Or, it's not a failure passive transfer issue. Maybe it is a slug or calving. It's maybe maternity got dirty. Maybe the pasteurizer wasn't working. We can tune in to what went wrong much more easily than if we wait for clinical disease to start, right? Because clinical disease isn't going to start for a few more weeks. And when you have more time between when something went wrong and when you can detect a problem in the calf, it's harder to match things up, right? But if we can figure it out a little earlier in the course of the problem, we get better at figuring out the problem. And so when we're talking about implementing lung ultrasound on farms, this is the approach that I kind of talk about using, right? The wean clean approach. And this means you can start scanning calves, right? The first place you can look is kind of just characterize your overall problem, right? What percentage of calves have pneumonia at the start of weaning, right? Then you can dig deeper. If that number is too high, you can say, well, why is it too high? Is it because they're not curing, or is it because we're not finding it? Then you can go look at the percent of calves and look at the severity of disease when they're being treated for the first time. You can look at response to treatment, so 7 to 10 days after they've been treated. And then you can use what I call 12x7 scanning, which is what a lot of producers are using these days. 12x7 scanning is what allows you to target in on when disease is starting. And we do this by starting at 7 days old. Typically, we'll scan 12 calves at 7 days of age. During the same visit, we're going to go and scan 12 14-day-old calves and 12 21-day-old calves and 12 28-day-old calves until we get a group of calves where we see 20 to 30% of the calves have pneumonia on the ultrasound. This helps us figure out, all right, the first group that we see where 20 to 30% of the calves have pneumonia, that's when things are starting. Okay, so that 12x7 scanning is a means to get some point prevalences of when disease is starting to help you focus in on managing high-risk calves and dealing with things right when the problem is starting. Okay. All right, so when we do that 12x7 scanning, we're working youngest to oldest. At the same time, if we're just troubleshooting, in general, a herd problem, we want to correlate our findings with serum total proteins or some quantitative assessment of passive transfer, so that we can look at whether or not low immunity in these calves is contributing to their risk of disease. And it also gives us an opportunity to look at the manure in these young calves. Very important that we focus on manure in young calves because of this link between abnormal manure and lung disease. And so I think it's very easy and it's very common for abnormal manure to be overlooked. Rarely is it recorded by producers if a calf has abnormal manure, unless something like an antibiotic is given. Okay, so looking at records to figure out how much GI disease is out there can be really misleading because a lot of times it's just not recorded. And the other thing is the fact that a lot of times, unless they're really severely affected, they're not going to receive an antibiotic, which is okay. But it means also that we don't know the full extent of the problem. And so we got to start really paying attention to abnormal manure, pay attention to these mucky butts. Because even if a calf is eating and drinking and bouncing around in their pen, if you see watery diarrhea or if you see excessively mucus and slightly loose manure, this is still not normal. Okay, it's still an indicator that our gut is unhappy. And anytime our gut is unhappy, they're way more likely to get pneumonia. All right, so if we can fix whatever is causing the unhappy gut, the lungs are going to start fixing themselves on their own. Okay, so really, really important that we tie those things together, right? So again, just a picture of a calf here, some abnormal manure in the pen. You can see hints of it there. Quiet calf. The point of this is actually this calf has got a sodium issue, so not necessarily secondary to the abnormal manure. So hopefully most folks would realize that this calf is not normal, even though the calf drank all of his milk. This is not normal behavior, kind of a base wide stance. Ears are a bit down and the calf is pretty dull. Okay. So again, just highlighting the fact that we've got to pay attention. Calves that have normal manure, they're going to have nice clean back ends. Calves that have or have had abnormal manure, they're going to show us. They're going to be signs of this. Okay. All right. And we can use our records again to show us when pneumonia is happening. I'm starting to run out of time here, but what I want to point out here is that, there are 4 of us over the years that have kind of been spearheading the research and teaching veterinarians out in the field how to use lung ultrasound. But I like to say that in the last couple of years, actually, there's kind of a new group, right? So this is Dr. Liz Cox, Sebastian Buczynski, Sam Berenger, myself. We're kind of the old farts in the room now. New veterinary grads are really spearheading this out on farm in their vet practices, implementing this in calf management programs for their veterinary clinics, and really providing an excellent service for this. So I want to say, if you're not doing this, or if you're a producer and your veterinarian's not doing this, there are options for folks to get trained. I just clicked on this because it's showing us that this practice that half their veterinarians are trained and are implementing this for their clients. And again, some folks would be like, oh, you can't do this lung ultrasound on a farm. It's not practical. It's just not practical. I did a little quick Facebook survey of a vet group. And what I found is that for those people, so these are the different states where people are scanning lungs, a lot of folks are doing a lot of calves. So almost 40% of the respondents are scanning more than 200 calves a week. This is 10,000 calves per year. All right. So this is a lot of calves getting scanned by one person. So don't be intimidated by the fact that you think lung ultrasound is not practical on farm. Veterinarians are doing it. They're providing a service that producers really value and utilize. And are seeing the value of it. And when we ask, well, is it worth the cost? Right. So I did a little write-up in HORS a few months ago. And as it turns out, when you use lung ultrasound as a screening tool to implement early treatment, it pays off, right? So this is just showing in this one herd where we have about 5 years worth of data, looking at the number of pneumonia events. Even though you treat more calves than you used to because you're finding more of them, you treat calves fewer times and you use less drug because you're treating them when they're younger and they're smaller. All right. So the overall drug volume used goes down. The mortality goes down. And you have a more valuable calf at 180 days because they're growing faster and they've needed less input at that point. All right. And your employees tend to be a lot happier because calves are doing better. So, here's one real life scenario where economically we are getting a benefit. In this particular dairy, it works out to be $507 per 100 calves raised, okay, by identifying and treating pneumonia earlier during that subclinical phase. So the point here is that hopefully that will come through is that the calves will tell you usually what the problem is. You just got to use power of observation. You've got to use some high quality diagnostics and something as simple as a lung ultrasound. Simple is a relative term to get those answers, right? And really kind of and listen to see what they're saying. The lungs and the gut, GIT, gastrointestinal tract, to me, they're the primary indicator organ in these young calves. And if they are not normal, they're telling you that something in your program is not working. You're not feeding them enough, not feeding them a high quality feed. They've got failure passive transfer. The environment's dirty, on and on. They're going to tell you when and where it's happening. You can use that Wean Clean framework to kind of set up a plan for implementation of lung ultrasound. It helps you prioritize findings. When you have these bottlenecks, you've got to think about what is most likely causing most disease and fix those first. And you can do a lot of things without running down the rabbit hole of doing a lot of laboratory testing for pathogens, right? There's a lot of management things that you can fix first before having to spend a lot of money on figuring out exactly what the bacteria is that's doing it. There are places and times when that is very important, don't get me wrong, but there are a lot of things we can do routinely without having to do a bunch of diagnostics first. So I think I'll stop there. This is my email, my phone number. You can look up Wing Clean stuff online, our Dairyland Initiative, and there's some more information there. So happy to answer any questions that you might have.
You had mentioned and then presented the ultrasounds of abscesses. Are these the precursors for the abscessors that the packers are finding? Are they actually originating before weaning?
Yeah, that's a really good question. And are you talking about cull cows and lung abscesses? Are you talking about the the Holstein beef where we're seeing the liver abscesses? Can you
Yeah,
clarify that question a little bit?
yeah. I'm thinking on the Holstein beef, the full-blood Holstein steers.
Yeah, that's a really great question. That is a big issue in the industry right now, is this really high prevalence of liver abscesses in the Holstein beef. No one has worked out that connection yet between, or if there is any connection between the lung abscesses and the liver abscesses. Really, I think that'd be a great question to look at. I think that when first I'll step back in that the lung abscesses that I showed you in the dairy calves, we don't see many of them at all in the pre-weaning period. When we do see them, they tend to be in the back part of the lung, and oftentimes we think they're associated with a navel ill. So in the umbilicus, the navel gets infected, you get some blood in the bloodstream, and it lands in the lungs and creates an isolated abscess. I myself have not, in dairy calves, have not seen an association between those individual solitary lung abscesses and liver abscesses. But it wouldn't surprise me in those Holstein beef animals, if they looked at the lungs, that whatever process is causing bacteria to land in the liver of those calves, you could also be seeing them in the lung. But that hasn't been worked out at all on the dairy calf side or on the dairy beef side. But I think that's a good question to kind of look into.
Okay, we've got a question that came in. How much should we expect a lung score to decrease after treatment before we consider the calf cured and cease treatment? Do you recommend recheck scans on treated calves a few weeks later to ensure relapses don't occur?
Yeah, so that first question, there's a caveat, and my expectation is if we have a brand new case of disease, meaning I'm here today, and this calf has a lung lesion, and I also scanned this calf last week, and she did not have any lung lesions, so it's a new case today. My expectation is that if we treat her appropriately by next week when I come back, so 7 to 10 days later, my expectation is that most of that lung lesion, that should be pretty much back to normal. That is what our goal should be. But when those calves have had that lung lesion for a longer period of time, it takes a lot longer, and my expectation for resolution in a short period of time gets much reduced. So I want to see a pretty rapid turnaround if we are able to catch it early. But if it's a chronic, we don't know how long that lung lesion has been there. It could be an extended period of time. Our hope is that a properly used antibiotic is going to decrease the duration that they have the lung lesion. And so if you recheck that calf 7 to 10 days later and she still has a lung lesion, and it was new the previous week, what I recommend is that if it's better but not completely better, is you retreat her with the same drug. If it's worse or not changed, then you may consider changing the drug therapy. If you know it's chronic and we're not seeing a change after treatment, maybe you do a second treatment and you're still not seeing any change. If that calf is subclinical, no visible signs of disease, then I say don't give any more antibiotics. Just let time play its course. And if she stays subclinical, great. Those lung lesions in most calves will completely go away. But in those chronics, if they become visibly sick again, you are obligated to treat. The treatment does improve the clinical signs. It will make the calf feel better. She still needs time for the lung lesions to go away. Okay. So that's kind of how I think about it. Hopefully that's not clear as mud, but if it's a new lesion, I'm going to treat, recheck in 7 to 10 days. I'll treat again if she needs more resolution, if she got a little bit, but it's not completely cleaned. I'll change the drug if there's no difference since the last week. And if it's completely clean, then I won't treat again. Okay. But if it's not responding to the antibiotic and the calf is clinically normal, then I'm just going to sit on her and keep an eye on her. And then only when she becomes clinical, I'm going to make a decision to either treat or euthanize or cull if she doesn't have any residue in her. It doesn't matter.
As
the
a
score.
follow-up question to that.
Yep.
Yeah, I just had a
Go ahead.
follow-up question to that question on those management decisions. You know, when are you seeing producers make some management decisions as far as culling or keeping them in the herd when they're trying to manage heifer inventory?
Yeah, a lot of so for folks that are scanning early pre-weaning period, no one likes to get rid of a young calf, right? No one likes to call it quits on them. And so it's highly variable depending on the operation. You know, if they're going to do 3 treatments or 4 treatments or 2 treatments, you've kind of got to decide where you want to draw that line. We don't have good data to say exactly what the right answer is. Just have to keep in mind the clinical aspect of it, right? So if she's clinical, you've got to do something, right? You've got to make a decision. Treat, shoot, get rid of. But if she's subclinical and she's already been treated and she's just kind of holding her own but not really getting better despite your treatments, then you know you've got the flexibility to sit on her and see what she's going to do. When it comes to slightly older calves, and so 4 months is kind of a common time that I see genomic results coming back or being used. So we'll see producers using genomics and rates of gain and their lung lesions to decide who we're keeping and who we're not. And it really depends on, you know, where you're going to draw your cut point, right? Are you going to keep the 3s or the 4s or the 5s? Well, it depends a little bit on the distribution of the lesions that you're seeing. So if you've got a calf that is well grown, has low genomics, but she has clean lungs, you're probably going to keep her instead of a calf who has high genomics, but is not well grown and has a high scoring lung. Hopefully that makes sense, right? So we'll see them at that kind of older age range when they're deciding who they're going to keep or not. And you look at the severity of disease, right? Obviously, if she's a score 5, I'm going to be more inclined to get rid of those calves than score 2s. Again, there's no cut point. There's no data to say, you know, absolutely where that cut point should be. But, you know, more lung is not going to be better, right? Less abnormal lung is going to be better. So if you've got to get rid of anybody, you're going to get rid of the ones that have the most severe lung lesion score at that age. Does that answer your question?
Yes, thank you.
Crowd
then,
is kind of
Fred, if
thin.
there's no other questions, I do have one. Oh, I did
Go
have
ahead.
one more question, Fred.
Go ahead.
In your earlier slides, when you had those 3 different farms, were there colostrum differences as far as passive transfer on those farms? I'm just curious.
So those are all 3 farms where every calf gets a serum total protein, and for the in their protocols for how they administer the colostrum might be slightly different. But in general, every calf gets a serum total protein, and in general, they're meeting the benchmarks that we're looking for as far as 40% or more above 6.1 and 70% or more above 5.7. So it's there's not a dramatic difference in their colostrum programs or the level of passive transfer, although recognizing that, you know, week to week, you do get some variability.
Okay, our crowd is kind of thinned down just a little bit. If somebody has a question, go ahead and unmute and ask the question directly. Thank you, Dr. Olivet. We appreciate the information that you've shared with us. And we'd like to remind folks that this program is being recorded and will be available at the Iowa State University Dairy Team website. Thank you again, Dr. Olivet.
Thank you.
And we will invite folks to attend our next dairy webinar on February 21, where we will talk about what we know or think we know about heat stress in dairy calves.